Hey folks, it's Dr. Gerstmar from Aspire Natural Health, and in this quick video, I want to answer a question we get fairly frequently here at Aspire Natural Health. You see, at Aspire Natural Health, we are experts at helping people with digestive issues and autoimmunity. Now, while a lot of people who come to us already have a diagnosis of an autoimmune disease, many others come thinking maybe they have an autoimmune disease, but they're just not sure. These people will often ask us if there's a test they can do to tell whether they have autoimmunity or not. So let's answer that question today. The first thing we have to talk about is medical tests, such as a blood test, a urine test, a poop test, whatever. Now, I remember back before I was a doctor thinking, they just took that sample and then they would just analyze it and they would see whatever was inside. But that is not how tests work. Each test is designed to look for a specific thing, and a test can only find what it's designed to look for. So, for example, a test that's done to look for iron in your blood can only look for iron. It can't tell what your blood sugar is like or how well your kidneys are working. There is not a test that just looks at everything. There are only specific tests that look for specific things. So when it comes to autoimmunity, is there one single test that can look for any kind of autoimmunity? And the answer is no. You see, autoimmunity is a broad term that means the immune system is attacking a part of your body. Since any part of your body can potentially be attacked by your immune system, there are many different kinds of autoimmunity. For example, if your immune system is attacking your digestion, that is called IBD, ulcerative colitis or Crohn's disease. If it attacks your joints, that's rheumatoid arthritis. Your thyroid, that's Hashimoto's. And if it attacks your brain, that's multiple sclerosis. The problem here is that while each of these types of autoimmunity is caused by the same thing, namely your immune system attacking part of your body, the diseases themselves are all different. So it's possible to test for specific kinds of autoimmunity. If in rheumatoid arthritis, for example, we can look for certain antibodies against your joints that aren't normally there, but most of the time are going to be there in rheumatoid arthritis. If we suspect Hashimoto's thyroiditis, we can test for specific antibodies that are part of that disease. Now, many types of autoimmunity have specific antibodies that can be looked for, and unfortunately, many don't, okay? So if you come in with your joints swollen and hurting and we suspect you have rheumatoid arthritis, we can test your blood looking to see if that's the case. But if you're just not feeling well and think maybe you have some autoimmunity going on, there is no general blood test we can do that can tell us whether you have autoimmunity or not. Now, having said that, the most general markers we have that can suggest there might be autoimmunity going on are our inflammatory tests. Now, inflammation is a word you've probably heard a lot of, and what it means is that the immune system is active. Now, in autoimmunity, since your immune system thinks a part of your body is a nasty virus or bacteria and is constantly trying to attack and kill it, you have chronic inflammation. We often see that inflammation in your blood with two simple and inexpensive tests known as a sedimentation rate and secondly, a C-reactive protein. If these tests are high, it means there's a lot of inflammation in your body, but it doesn't always mean you have autoimmunity. For example, if you were sick with a cold, you would find those markers are increased because your immune system is active and busy fighting the cold. So there you have it. Is there a single test you can take to tell if you have autoimmunity? No, there isn't. General inflammation tests like sedimentation rate and C-reactive protein can tell us if there's a lot of inflammation going on, and that can be a valuable clue that there's autoimmunity. And there are specific tests that can look for certain autoimmune conditions. Some autoimmune diseases are going to be fairly easy to diagnose, and some are very tricky. Celiac disease, for example, takes on average 7 years to get diagnosed from when symptoms first appear because many doctors aren't trained properly to spot it, and it can be very challenging to figure out. If you or anyone you know is dealing with autoimmunity, I'd like to offer you the guide we've put together on how we treat autoimmunity here at Aspire Natural Health. All you need to do is fill out the short form below, and we will happily send that to you for free. So please click down below. At Aspire Natural Health, we are experts at treating digestive issues and autoimmune diseases. If that's you, we would love to connect. We offer a no obligation, no pressure chat to see if we can help you and if we're the right fit to work together. If we are, we'll move forward. And if we're not, we will do our best to connect you with the person who can best help you. You have absolutely nothing to lose. So please call us now at 425-202-7849 or email us at info@aspirenaturalhealth.com. All right, folks, until next time, take care.